Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Doug Iliff of Topeka about generic drugs. Thanks for being here today, Doctor.
You're welcome.
Now, if we've been taking a certain medication for a while now and all of a sudden the color or the shape of the pills change, is that something we should worry about?
Well, it's probably not. I imagine what has happened is that you've been switched from a trade name to a generic drug or from one generic to another. And when the manufacturer changes, the color and the shape change, but it's probably still the same thing.
Okay. How is a generic different?
Well, a generic is a name for the chemical name of the drug. Take Lipitor, for example. Lipitor was the first $10 billion drug in the history of pharmaceutical sales. And last November, it went generic. They lost their patent protection. It's now available as atorvastatin, and so patients who are taking Lipitor might start to see atorvastatin show up on their drug bottle, and it may be a different shape or color. When a drug goes generic, about 80% of the sales disappear for the trade name manufacturer in the first year.
Okay, so generics are a good deal then?
Generics are a terrific deal. I've been an advocate for generics for a long time because they're so much cheaper, but the amazing thing now is that every year, 1, 2, 3, 4 drugs that have been terrific drugs for us, but very expensive, go generic, and all of a sudden they get to be dirt cheap.
Okay. Do I need to ask my doctor to use generics?
Well, it's always a good idea if you're on an expensive drug to just remind your doctor every time you see him, is it possible that we could switch to something that would be cheaper? There's a couple reasons why that may not be necessary though. For one thing, if the doctor doesn't say no substitution on the drug, on when he writes the prescription, the pharmacist will oftentimes switch you to a generic automatically. They get a little bit more money for the generic, so there's an incentive for them to do that, and then they're legally allowed to do it. The other reason is that most insurance companies are tied up with some kind of a benefit manager, and that company that dispenses the drugs will oftentimes send me or my nurse a fax saying, would you mind if we switch this patient to something else? And we hate those faxes. They waste our time, and so it's an incentive for us to pay attention and try to use the cheapest drug possible.
Okay. Is there anything else that we should know?
I think that you should pay attention to the total cost of something. People forget sometimes that you can pay cash for a drug. I've had experiences where patients will pay $10 or $15 as their copay through their benefit manager, and really the drug would have cost them $4 if they just paid cash. So you might ask the pharmacist which way to go.
Okay, great. Thank you, Dr. Iliff.
You're welcome.
Please join us next week for a new health topic discussion on House Calls.